announced outbreak of diphtheria at Pollsmoor Correctional Centre in the Western Cape has claimed one life. More tests have been conducted. Up to 55 close contacts have been identified and placed in isolation as the Health Department continues its investigation. To tell us more about the health situation in the Western Cape, we are now joined by Dr Saadiq Kariem from the Western Cape Health Department. Doctor, we appreciate your time this morning. Very important for us to first of all start with what exactly diphtheria is.
Diphtheria is a bacterium. In fact, it's called Corynebacterium diphtheria, and it's a bacterium that unfortunately also produces a toxin. And the toxin is what can cause quite significant damage to the tissues surrounding, particularly the throat. It causes necrosis of the tissues around the throat, and that can obviously lead to difficulty breathing and swallowing. But if that toxin gets into the bloodstream, then in fact that process can happen in other organs as well. And so sometimes people with diphtheria can then develop cardiac problems or renal failure even.
Doctor, how could this inmate possibly have contracted this?
One of those vaccine preventable conditions, and it's really quite important to stress that it is preventable. But what we do know is that people don't often complete their schedule, and this is a schedule that we do when children are very young. And it's free of charge at all our public health facilities in the province and around the country as well. But people then who don't complete that schedule of vaccination, as they grow up, are obviously then susceptible to picking up diphtheria infection. And so it's quite important to stress that people need to take their children for the vaccination. And that's at 6 weeks, 10 weeks, 14 weeks. And then at 18 months, there's a booster dose. And when children are 6 years old and 12 years old, and that's the vaccination schedule. And it does prevent such a severe infection.
So are we saying that this inmate then did not receive his vaccination, and that's how he contracted diphtheria?
Likely. I mean, obviously we're speculating in terms of his history of his personal care, but I mean, those people who have not completed their vaccination schedule, those people are definitely susceptible. And then, of course, we have to be very careful and monitor all the close contacts of the inmate. And like you mentioned, there were 55 other inmates as well, but there were also 13 prison staff that were close contacts of the index patient who had died. And so we have to make sure that we're also monitoring all of the contacts as well. Out of those 78 contacts, there were in fact 11 other cases. Fortunately, they're all either asymptomatic or have mild infection.
Doctor, I would like to know, what are the confirmed cases looking like in South Africa in general at the moment?
So this is an outbreak, a localized outbreak at Pollsmoor Prison. Diphtheria does from time to time, rear its head in other provinces as well. I'm not sure about the overall number currently at the moment around the country, but these tend to be localized outbreaks. So this is not like we've had with coronavirus, for example. These localized outbreaks, and I think the last one, and in 2023, we've had 2 or 3 cases in the Western Cape as well. Those were mild cases. But obviously, we know that they were diphtheria because we do a swab of the throat, and that swab gets tested in the laboratory. I think the last big outbreak was in 2015 in KwaZulu-Natal, where 4 people died out of a total 15 cases.
Now, Doctor, I know there are efforts to contain the outbreak at Pollsmoor. I also read that some of the staff members, the correctional officers, I think there were about 2, that has shown some symptoms. Should we be worried that perhaps their family members could have contracted diphtheria as well?
What we've done with all the contacts, we're obviously isolating them, making sure that we can contain the infection as much as possible. So for the prison itself, and we're working very closely with the Department of Correctional Services at Pollsmoor, what we've done is the outbreak had happened in one part of the prison, and that part has about 1,200 inmates and about 240 staff members. So we've cohorted all the contacts in that part of the prison, And obviously, we make sure that people are wearing masks and practicing personal hygiene. We monitor the contacts on a daily basis, and obviously we provide them with prophylaxis as well. It's an antibiotic that we provide them, and been providing vaccinations to those inmates as well. Thus far, we vaccinated about 567 inmates as well. For the prison staff who are at home, again, we ask that they isolate themselves from their families, and that we obviously monitor these symptoms on a daily basis. So it's all about managing the outbreak and following some of the protocols that we've put into place and that we know work very well.
Doctor, we've got about 30 seconds left. I'd like to know, for the family members of inmates at Pollsmoor Prison, should they be worried? What would your advice be to them in about 30 seconds?
No, we've got it under control. We're working quite closely with correctional services, and we're monitoring the situation on a daily basis, and our teams are on the ground there. So at this stage, would advise them not to be concerned.
There we have it. Thank you so much. That is, of course, Dr. Saadiq Kariem from the Western Cape Health Department.